One of the most common things I see at the clinic is low back pain. Whether it's the young gymnast or dancer that we often see at On the Move or the adult patient, we'll start with a conversation about when the pain started and what the goals are for physical therapy and what things have made the back feel better and what things might reproduce the pain. We'll take a look at some functional movement and whether or not there's asymmetries in the way that the spine moves. And we might try to gently reproduce the pain if appropriate to see if we can then treat it and make that movement feel better by the end of the first visit. We'll take a look at range of motion and strength, obviously not the whole body, but whatever we typically find is pertinent to the situation. And we'll feel the area of discomfort to see if there's a segment that needs to be worked on or some muscles that need to be worked on. Oftentimes people come with not just a goal to address the pain, but to improve on something like flexibility and strength. And so we'll take a look at that and add those types of goals to the things that we'll address eventually with physical therapy. But definitely want the person to go home with a good handle of what they can do on their own and ideally feeling better already after that first visit. So we may look at some exercises and really try to customize it to the patient, starting with something simple and then so that they can feel successful with it. And then if appropriate, progress until we find something that's challenging enough. I really like using the foam roller as self-massage and stretching tool, but also as a stability device so that it's portable, it's not too expensive, and it tells you right away if you're moving in an unstable way because you'll fall off of it if you are. And then also for the gymnasts that we see, often at times they have pain going backwards into their back bend. And so I might use a ball like this to teach strength going into extension. It also really feels good just to lie down on it. And then hopefully by the end of the visit, they're feeling pretty good and they can take a look at some of the motions that had hurt during or prior to coming to physical therapy. And they can see that it feels better already.